Does someone you love snore? Does it keep you up at night?
Well, now there is a simple pain-free solution at the dentist that could end the snoring for good.
This I had to see. Take a look.
This sounds too good to be true. What are you doing today?
Well, today I'm doing a procedure called Soleil Sleep, and what that does is it treats snoring. So I'm going to be using a laser on the back of his throat and on his uvula, and it's going to be basically shrinking the collagen fibers in that tissue to tighten it up and to actually open his airways.
Dr. Renee Kurtz has her doctorate in dentistry from Tufts University and lectures on the latest life-changing dental procedures in California. But as a hometown girl, she wanted to bring something called Soleil Sleep to her office in Cheshire to help people like Paul Nadeau.
The people around you, do they say you snore a lot?
That's what she told me, I don't know.
We've been doing it on patients for several months now, and we've had great success with it.
What do people tell you after it's done?
I've had people literally say right away that they feel like they can breathe better because they feel their airways open. And when I talk to patients, a few days later, they say, it's amazing. Their spouse or they will tell them that, they're not snoring. They find they're sleeping better.
Let's do it.
So essentially, it's like we know laser for maybe getting rid of wrinkles or tightening other things. This is the same thing. As we age, the back of our throat can loosen, and then when you tighten that back up, the snoring will diminish?
Right, yeah, so it's a CO2 laser, and yes, it is used on skin. So as we age, the collagen fibers in our skin breaks down, and so we get wrinkles. In the back of our throat, the same thing happens. Those collagen fibers break down, and the tissue gets very loose. And so when you're breathing in and that tissue vibrates, you snore.
It's done in the office and doesn't hurt. Just a little numbing spray, no cutting or needles.
I kind of start in the middle and kind of treat one side of the palate and then the other. So it's just small little bursts of laser energy. I guess it just intrigued me that, so many people suffer from snoring, whether it's the person that snores or the person that's with them. And also treating sleep apnea, I just found it's a great way, to also help, people breathe better at night.
Results can last about 2 years, and then you can come back and get a refresh with the laser.
And that is it. So that took, about 5 minutes or so.
And the procedure is under $500.
Just a little burn, but not even enough to talk about it.
Paul might be off the couch tonight.
Initially, about 75% of that contraction happens. So, and then over the next 2 to 3 weeks, the tissues will contract a little bit more. So you'll get most of, the results tonight. And in about 2 to 3 weeks, you'll have 100%.
So snoring isn't just an annoyance to your partner. It really could be a major health issue.
It really can, yeah. If you're not breathing and you're not getting oxygen into your body's not relaxing at night, and it's fighting for air. So not only are you not sleeping well, your body's not relaxing, it's not re-energizing.
That can lead to serious health problems.
Daytime sleepiness, loud snoring, diabetes, obesity, heart failure, and hypertension.
Dr. Kurtz will give you a sleepiness test. If you score high for falling asleep while sitting, watching TV, or even in a conversation, you may need a sleep test for sleep apnea.
If I do feel they do have some sleep apnea issues, I can refer them to a company called sleeptest.com. And I send them, I put all their information in, and everything goes through medical insurance. It is covered through medical insurance, and they will send a sleep study to your house so you don't have to go to a strange place.
This is what Paul usually has to treat his sleep apnea. Dr. Kurtz has a way more comfortable idea.
Instead of a whole contraption going over your head and mask and all that, we can make a simple little appliance that goes on the tops and the bottom of your teeth. And it basically pulls your lower jaw a little bit forward at night, which also brings your tongue forward and opens up your airway so that you can breathe. There's little fins on the sides of these, and what that is for is so when you are wearing these, you can still open and close and go side to side, but your lower jaw cannot collapse back. So it keeps your lower jaw forward, hence keeping your tongue forward and out of the way of your airway.
This seems like this could be such a lifesaver for couples.
It really has. I mean, I make sure to ask my patients afterward how it was, and I can't tell you that, the reactions that I'm getting, people saying, I had one gentleman tell me, his wife actually comes up to bed now. She used to stay on the couch. Or, I worked on a woman the other day, and she said her sisters will travel with her because no one wanted to be in her room because she snored so much.
Yeah, that's definitely a problem.
Yeah, so if this sounds like a solution you want to learn more about, you can visit mycheshiredentist.com or follow Dr. Kurtz on Facebook at My Cheshire Dentist and on Instagram at Dr. Renee Kurtz, DMD. I do hope Paul is doing much better and that his longtime girlfriend is actually sleeping better
Yeah,
now.
that's great. What an
It's going to be really life-changing. A lot of people,
Absolutely.
they
I
get
think
to a
it's
certain
wonderful.
age and the snoring just becomes a big problem.